walk in and you are understaffed, the hallways are overcrowded, and you are pushed to your limits every single day. You give up everything you have while you're at work, but that's not enough when the system is being starved of funding needs. Patients are laying in hallways, surgeries are being delayed, and you, the workers, are being burnt out. And still, this conservative government looks the other way. Well, folks, not today! We're here to raise our voices. We're here today to stand together. And we're here to cause good trouble. It is my pleasure to introduce our very first speaker, Pam Parks, from 6364. Pam.
Hello everyone. Enough time to finish my candy, so sorry for chewing. Pam Parks, President CUPE 6364. I'm also co-chair of the Durham Health Coalition, and I'm here representing approximately 3,500 CUPE members. At Lake Ridge, which owns the hospitals down from Bowmanville, the 401 to Pickering, and up in Port Perry. At the end of the day, our members are burnt out, they are demoralized, they're overworked, they're tired, and the patients are coming in as we, the workers, are being eliminated by the employer. So when that happens, you know what they do? They just add the work onto the people that are already burnt out and all. At Lake Ridge lately, we noticed, I think it was Joe and someone else that went up talking about the elimination, because Lake Ridge think that if they give us notice of elimination for 908, 909, that their job is done, because they can do it. But we know, the ones of us that's been around long enough knows that if there's an elimination, you got to do X, Y, and Z. 908, 909 clearly. So the employer, we heard it this morning, they try to get around because they do not want to pay people that are actually deserving of packages. So they do this reassignment jigsaw puzzle where they try to hoard jobs, which we are very vigilant on that. So trust me, when we see the list of vacancies come out, we go, where did that come from? Because we see them posting, and they're just trying to say, oh, I don't know if the folks have heard this, we created new jobs, right? That is their go-to now. So when the unions say to them, okay, what about these people that you should be offering early retirement, exit packages? Oh, and this is what they're saying. You're telling me the unions say they want layoffs, and we're saying no. We're saying there's a process to follow the process. At the end of the day, about approximately a month ago, they gave 3 notice of elimination to our dietary staff. And you may say, well, it's only 3. But it's not only 3. What happened is, they gave the notice to dietary, and then even before the ink dried, they haven't even spoke to the union. We just heard it from our membership. They come to us and they say, did you know that now the nurses are going to deliver the trays? And I'll go, what do you mean? They said that the employer said that, well, CUPE is aware of it and they're in full agreement with what we're doing. So anyhow, we finally had our meeting, and they confirmed that they're eliminating the jobs, but they don't know what we're worried about. And at the end of the day, the nurses will be delivering the tray. I know some areas they do differently, but at Lake Ridge we have classifications for a reason. So if you keep chipping away at one classification and you do nothing, before you know it, they're coming for your jobs, right? So we raised the issue. We had a rally last Thursday. Thanks to those of you that came out. But at the end of the day, what that happens, it didn't just stop there. We have our patients, as we know, we're healthcare workers, they're diabetics. So the employer, and this is all about changing, saving budget bottom line. They forget we're dealing with real people here. So they decided that like on different units, we have a pantry, or you go down to the kitchen, dietary goes down and get the snacks, put it in the fridge, you know, people missing their tray, meal tray for test or whatever, we can run and grab something quickly to do. No, Lakeridge cut that out. And they said that if you want food, you need to contact security. The nurse got to contact security, and Lakeridge is huge, especially if you're at the OCHU site. Go downstairs, wait for security, go downstairs, get the food, but oh, by the way, my patient over here is in a diabetic reaction that, you know, sometimes just a quick little juice, something can bring them back up. None of that's on the unit. Lakeridge, they don't care. We brought it up as a union executive. We told them this is not going to work. They are just going full force. So I just want to say to you folks, just like was repeated this week, that don't just stand there and let them walk all over us. When they come to you with eliminations, I usually say to them, we say to them that, you know what, yes, you have a right to eliminate, but the job is still there. Freaking hire your permanent staff. The patients are suffering. They come in, it leads to violence. Who do they take it out on? Us. Because, you know, heaven forbid that you say, today we're working too short because they will not replace your sick time, and that's what Lakeridge does. They don't replace sick time before, and I'm not advocating for overtime. You know, you would pick up the odd overtime here and there because you don't want your co-workers to work short and you want to look after your patients. They cut out overtime. They say, some managers say to their staff, no, we're working short. Just keep working. Add the workload. And I think that is shameful. So I just want to thank OCHU and all of you activists. Stand strong. And at the end of the day, we'll be out there doing the good trouble. Thank you.
Thanks very much, Pam. We also have the fortunate to be working with the Ontario Health Coalition, and they have a chapter here in Thunder Bay. And I want you all to welcome Jules Tupter. He is the chair of the coalition here. He used to be a CUPE member.
Thank you very much, everybody. Yeah, as you heard, I worked for the City of Thunder Bay. I was the president of CUPE Local 87 for a number of years. Then became a staff rep for CUPE here, servicing the hospitals and all sectors between here and Rainy River, the end of Yonge Street, as everybody knows. Yonge Street, and so 33 years of my life has been spent with CUPE. So it's amazing to see you here on behalf of Thunder Bay Health Coalition and the Ontario Health Coalition, because I'm on the board of the Ontario Health Coalition also. I want to welcome you here. I think it's fantastic that you guys are here raising the issues. We try and do what we can here in Thunder Bay and Northwestern Ontario, and it's hard to get people out, but when I see people like you, then it encourages me, and it tells people across Northwestern Ontario that there are people that are concerned, that we are standing up for our health care, and we're going to stop this Harris government. That's how old I am. I started working when Harris was around. Stop this Ford government. They're all the same. Anyway, stop the Ford government from doing what they're doing. They're making a mess of the healthcare system. And as you see some of the signs that I got here, is public health care is for the people, not for profits, and that's the problem. All this government is concerned about is making profit for their friends. They're trying to privatize. Absolutely. They're privatizing our health care. It's amazing now how much more money is going to private clinics and private hospitals. They're giving more money to the private clinics and the private hospitals than they are to the public hospitals. It's absolutely shameful. It's absolutely shameful. And it all started, the big move started back when Mike Harris was around. And as I said, I was working when Mike Harris, I was a staff rep when Mike Harris was around. And we started fighting it then, and we're still fighting it. And it's an ongoing battle. And we need people like you. We need the general public. And and all the stuff that I'm doing. I always tell people it's a numbers game, folks. When there's 10 of us standing up here, we've been here before in front of Kevin Holland's office. When there's 10 of us out here saying this is wrong, he's going to say, well, shit, I don't care. I'm losing 10 votes. I don't care about 10 votes. But when there's 300 or 400 or 500, that's what we got to do. We got to get the people. We got to get the general public to understand what the hell is going on. And if we all stand up together, we can make the changes. One or two of us aren't going to make it work, but if one or two of us all get together and start doing stuff, then we're going to win this battle. So thank you all very much for coming here. It's nice to see so many people. I grew up in Toronto. So thank you all very much for coming.
Thanks very much. Our next speaker, Stacey James.
Hello everyone, my name is Stacey James. I'm the president for CUPE Local 5852. I am here today to talk about how healthcare workers are burnt out. We need the funding for our hospitals. I work at a healthcare facility and I have seen our members in tears, haven't had enough hours to pay their bills. When there is a sick call, sometimes it is not replaced by anyone, creating workload issues. Many hospitals are in deficit and need the funding from the government. This has created a lot of job loss. We are going to continue to rally until healthcare workers' voices are heard. There has been an increase on violence in the workplace, injuries to workers, and shortage of staff. RPN workloads has also increased with many hallway patients. Nurses have reported having up to 8 patients per shift. Patients would be waiting for hours in emergency department before they can get a bed on a unit or care. Many patients will not get the quality care that they deserve. This is what happens when hospitals don't get the funding. Healthcare workers need to be treated fairly and do not deserve to have their jobs cut because we all have families to feed. So please, listen to us and give the hospital the funding that they deserve. The government contribution is more than a donation. It is vital investment in life savings care and a long-term wellness of our community.
Yes, yes.
Didn't get in there.
I will be hosting a rally on June 1st at 11 o'clock a.m. to 1 o'clock p.m. at Centenary Hospital in Scarborough. So please come out and support us. I am here at Thunder Bay today to support everyone in this community. We are facing a lot, and we're not going to sit down and allow the government to take away the funding from the hospital. And we are going to fight.
Thanks very much, Stacey. The next speaker is Amir
Yeah, I don't think it's useful though. They're all from Toronto.
Hello everyone. Hi. My name is Amir Sigarchi. I'm a president for Local 942 at the Royal Ottawa Hospital. First of all, I want to say thank you for coming because it's important to show solidarity on this stage that this government is going to do with our workers, our employees, and impact on the patient care as well. So as you might know, we got notice of elimination jobs where we hold a long-term facility within our hospital, and they told us that they're going to eliminate 15 positions of frontline workers. So I wanted just to highlight a little bit of, obviously it has gone up since then. Now we're at 45, 47 position. It's increasing every day. But I just wanted to highlight some of the impact it has on the patient care and our staff. So bear with me. sorry. The residents in our long-term care have very complex needs. Many of them have mental illnesses and are not independent. They need support from trained, experienced, and compassionate workers. They need support with bathing, toileting, eating, and walking, and taking medication. They need help with basic tasks of daily living to provide their dignity. Providing good care to this resident is a matter of respecting their human rights, but now that has been taken away. This worker, if these workers are laid off, the residents will face delay in their care. And here we're talking about patient care. They will be forced to wait at mealtime, to wait for assistant in the going to the washroom, to take shower regularly. They could slowly lose their ability to walk and confined to the wheelchair. Their quality of life, their life will suffer. These residents deserve better, and so do our members, our staff. Understaffing is harmful for workers. It leads to heavier workloads and strains their bodies and minds. It leads to higher injury rates and burnout. These workers pour their heart and soul into their job to take care of residents. They deserve a government that cares about them. So we're here today to let Kevin Holland and this government know that enough is enough. We're not going to accept this. We're going to be here today. We're going to be everywhere. We're going to continue until such a time this government is going to provide proper funding to our healthcare. We're not going to let that go. So please, Mr. Holland, listen to us and advocate for better funding for our healthcare system. Thank you.
Thanks very much, Mayor. Our next speaker is Amanda Hito from 870 The Pearly. Amanda!
Thank you, Sharon. Hi, my name is Amanda Hidon, and I'm the interim vice president of CUPE Local 870 based inside Pearly Health, which is in Ottawa. In October of 2025, the employer cut 39 positions due to funding cutbacks. 33 of those positions were directly frontline workers, our RPNs and PSWs. This government must do better for the residents we care for. As Amir stated, the residents that we're working with have dementia, they have other comorbidities, they have mental illness. It takes time to do their care, time that we don't have. If we have a sick call, the person's either not replaced or a replacement comes in much later. When that was brought up to management, they said, well, at least you have somebody. But we're working an hour without a partner when all our residents on this particular unit are 2 to 3-person care. When we're short an RPN because of a sick call, they now pull an RN to work in that position. When the RN is pulled, we no longer have the added support that we need. This leaves the RPN doing the med pass, doing the follow-ups, doing the assessments. She's also expected to monitor the hallway and assist the PSWs as needed, which is putting her license at risk. Patients from hospital are being admitted into long-term care facilities with complex needs, requiring additional time to provide care. We recently had someone sent out to hospital when they returned, their pressure ulcer was so large and infected. We now have to take 40 minutes in the morning to do one person's care. We are a 20-bed unit. So a 20-bed unit often working with one RPN. Our residents, as much as we try our stop-and-go approach, our residents are now exhibiting more responsive behaviors. They don't know how to communicate their needs with us. They punch, they kick, they bite, they spit, they headbutt. There has been an increased rate of violence against workers, some which are passed off. Oh, they have dementia, so it's all right. No, it's not all right. It's still violence. And even if you sign up to work in a behavioral unit, it's not something you should face daily because of lack of training or lack of staff. The seniors and vulnerable populations in long-term care homes and hospitals deserve better. They deserve to be washed every day. They deserve to have the freedom to move around the units freely. They deserve the right to not be put into a restraint because we don't have enough staff or time.
Shame. Shame.
On top of this, not related to my position in long-term care, anyone who has tried to access healthcare in our province has waited an exceptional amount of time that should not have been waited. Think of a child who's 7 years old who has a dislocated elbow and an open break in his arm from a small town transferred to CHU. He waited 24 hours in the emerge because there was no doctor to assist him. No doctor there to set the bones back. And the nurse was overwhelmed with her workload and missed his med pads for pain management. A 7-year-old. Another child waiting on the wait list for an iron infusion. That iron infusion wait time, even though it was deemed critical, is over a year wait. We were referred to a private clinic. This is my own family experience. I proudly wore my CUPE sweater. Thank you, OCHU, and thank you for everybody here. Together, as we stay in solidarity, we can fight back against our government and the privatization.
Thanks very much, Amanda. Thanks for sharing those real stories. Our next speaker is a speaker from Markham Stouffville Hospital, Leslie Sullivan.
Hi everybody, I hope anybody who's from out of town secured their spot on our jet that we own. Make sure you can get there. I just want to say, and I'm going to reiterate what everybody here is saying, we have 65 people who are affected. Shame. Point blank, it's unacceptable. Our nursing staff are doing absolutely every job under the sun, which is contracting out. I don't care how you look at it. We have volunteers who are doing nursing work. We have volunteers who are handing out dietary trays. We have volunteers doing our work, and it's all on Acorn, and you can find it. It's unacceptable. I know that the rest of my team really wanted to be here today, but they couldn't, and I know that we're definitely going to see some people at their rallies. We're coming over. Together, I know we can make this happen. I know I'm a new president. I know that I got the greatest team in the world with OCHU behind me, and I know that I got everybody in my area, and now my entire Ontario team behind me while we work towards getting these guys back to work. And I hope everybody has a pleasant day.
Okay, our next speaker is Richard Rigsby from CUPE 786. Richard, is he not here?
Right here.
Richard.
Thank you, Sharon. Thank you, everybody, for attending today. My name is Rick Rigby. I'm president of CUPE Local 786 at St. Joe's Healthcare Hamilton Hospital. Our hospital is a regional mental health hospital facility, also specializing in ortho, eye surgeries, bariatric, kidney care, and addiction services. We service a low-income community that has been facing an opioid crisis, a large and growing homeless population, an aging population, and a growing new Canadian population that all need our services. Our employer is facing a $12 million budgetary issue this year. They have eliminated IV nursing team, PSWs, administration staff, health records management staff, and the closure of the East Regional Mental Health Facility. Okay. So, and most recently, 90% of our payroll department. And the cuts will not stop there. We're well over 40 plus cuts and continuing. Absolutely. While this is going on, our employer is rapidly replacing frontline care with AI technology. These systems undermine services based on class, disability, and status. The union sees this as discrimination dressed up as innovation. While healthcare workers are being stretched to the limits, while patients are waiting longer than ever for care, The government continues to make decisions to reduce frontline staff and services and replace them with AI technology that does not solve the real issue. The government and employers tell us that these AI technologies will make the system more effective and reduce wait times. But we know better. We know the truth. We cannot replace real people with a computer screen and expect to have the same compassion, knowledge, and care that we all do. We cannot solve the staffing crisis with machines. We cannot cut resources and expect a better health care for our communities. These technologies do not benefit our communities. It benefits the pockets of our employers. With the lack of family doctors, huge patient increases coming to our ERs and urgent care centers, growing wait times for surgeries, hallway medicine, high nursing to patient ratios, and huge increases in violence in the workplace, directed towards our members within this organization, and a government that deliberately underfunds and starves the public health care system. It is clear this government does not care about the people of the province. The piggy bank doesn't seem to be empty. While he's building spas and buying jets, his focus is not on you, your family, your friends, and your community. It does not fix hallway medicine, long-term care, or increasing health care services. No, this government's focus is on hiding phone records and their rich corporate donors. We the people, along with our communities, must fight back like never before. We need to do this within our communities around the province. Public health care is a human right, and we at CUPE have a duty to show up, to speak up, and fight for the people that cannot. Can I get a chant of speak out, fight back? Speak out, fight back! Speak out, fight back! Speak out, fight back! Speak out, fight back! Thank you. St. Joe's will be holding a rally on May 22nd between 11 to 1, and we really value your support as the cuts keep coming. Please and thank you. Thank you, sir.
Thanks very much, Richard. Now it is my honor to introduce the Vice President of Area 2, the President of CUPE 7800, Jillian Wright. Jillian!
Hey everyone! One thing I know about OCHU is that we're loud. Very loud. I'm gonna ask, I see some little ones, and I want to know if they want to come stand here and stand with us. The reason why is because we're standing here for them. The other reason is I don't want them to have to stand here for the next ones. We need to stop this, and we need to stop it now. You're the little baby. Where are the They're gone. They gone. All right, so you're going to hear a lot of repetitive information because these are the facts and this is the reality. And this is what we're all facing right now, right? We're here today because healthcare in Ontario is being stretched past the breaking point. We were promised changes, we were promised funding to end hallway healthcare, and that the people of Ontario will never use their debit or credit card. I have not seen these changes. Have you?
Because they're lies.
No, because every day gets worse. Every day the wait times in the ER get longer. The list for surgeries get longer. People suffering in pain or immobility waiting for surgery. Every day unconventional places are turned into patient rooms like closets, break rooms, and hallways. Every day healthcare workers walk into hospitals that are understaffed, overcrowded, and underfunding. And every single day the cry from healthcare workers working past their breaking points, having additional tasks put on them, and most importantly, their pleading for a change is ignored. It is ignored because the Ford government and the MPPs like Kevin Holland, their priorities are anywhere except the public health care system. This isn't a crisis that came out of nowhere. It is a result of choices. Political choices to underfund public health care while demands keep rising. We are not asking for miracles. We are demanding the basics. Because right now, workers are leaving, patients are waiting, and the system is failing. To the office of Kevin Holland and to this government, you cannot claim to support health care while starving it. Every delayed surgery,
every closed bed, every hallway bed, every patient waiting for hours for care, every burnt out worker. These are the consequences of underfunding. We need actions, not announcements. We need not to be ignored. We need action because healthcare is not a line item, it is a lifeline. And we are not going anywhere until it's treated like one. So we are here today, standing strong, standing together, asking Kevin Holland, who has a part and able to fix this, so asking directly, clearly, will you stand up for public health care? Will you push the government to invest in public health care for the people of Ontario, for the people of Thunder Bay? And if this government won't listen, we'll go to Queen's Park. Because we're going to keep showing up like at offices like these, and we are going to keep pushing this government until they do. Because healthcare is not optional, it's essential. And we are not backing down. Thank you.
Thanks very much, Julian. It is my pleasure to introduce our next speaker, Sue Pivalica, our Francophone VP.
Bonjour tout le monde. Sue Pivalica, vice-présidente francophone du CSH. Nous sommes ici au bureau du conservateur Kevin Holland, ici à Thunder Bay, en réponse au mépris flagrant du gouvernement provincial à l'égard des conditions de travail et des soins aux patients. Plus de 70% des hôpitaux de l'Ontario font face à des déficits budgétaires, puisque le financement provincial ne suit pas la croissance démographique ni les besoins de la population. Par conséquent, des milliers d'emplois d'hospitaliers ont déjà été supprimés dans la région du Grand Toronto, à North Bay, Hamilton, Ottawa, Niagara et London. Et ceci malgré une pénurie chronique du personnel dans la plupart des établissements. Nos hôpitaux peinent à répondre aux besoins de la population parce que le gouvernement refuse de couvrir les coûts de la gestion de notre système de santé. Shame. Ce gouvernement a promis d'éliminer des listes d'attente chirurgicales et mettre la fin aux médecines de couloir. Pourtant, 200 000 personnes attendent actuellement une chirurgie et 73 000 patients attendent plus longtemps que les délais cliniquement recommandés et 2 000 se trouvent sur des civières dans les corridors en attente d'un lit. La pénurie de personnel et de capacité est sidérante dans les hôpitaux de toute la province. À l'hôpital de Thunder Bay, seulement 24% des patients à l'urgence sont admis dans le délai de cible de 8 heures. Le temps d'attente à moyen d'urgence pour ces personnes nécessite une admission au Centre régional des sciences de la santé de Thunder Bay est de 19,2 heures, plus élevé que la moyenne provinciale, qui est 18,7 heures. Thunder Bay a besoin d'investissements majeurs pour renforcer le personnel et la capacité, éliminer la médecine de couloir et assurer les soins en temps opportun. Les compressions budgétaires du gouvernement provincial rendent cela impossible. Les patients ne reçoivent pas les soins qu'ils méritent dans nos hôpitaux, y compris ici à Thunder Bay. Les travailleuses et les travailleurs de la santé sont à bout de souffle et font de leur mieux pour offrir des soins de qualité, mais ils ont besoin d'un meilleur soutien, des niveaux de dotation sécuritaire, des charges de travail gérables et un système hospitalier adéquatement financé. Nous demandons au gouvernement de l'Ontario, aujourd'hui, qui finance les hôpitaux au taux le plus bas du Canada, d'investir véritablement dans les hôpitaux publics. Il est absolument nécessaire d'améliorer les conditions de travail qui sont en réalité les conditions des soins. Merci beaucoup.
Thanks very much, Sue. Why don't we do another chant? Because I think like everybody's energy is getting pretty low. It goes like this. You probably have heard it before. Hey, hey, ho, ho, underfunding's got to go.
Hey, hey, ho, ho, underfunding's got to go. Hey, hey, ho, ho, underfunding's got to go. Hey, hey, ho, ho, underfunding's got to go. Hey, hey, ho, ho, underfunding's got to go. got to go!
Thank you very much. That was great. I think Kevin's starting to hear us in there. Our next speaker is our first Vice President, Kevin Holland. Kevin!
Thank you, everyone. We are here today because this government is telling the people a fairy tale. But the fairy tale is there's record funding in our hospitals and everything is okay. But the truth is 700 jobs gone across this province. North Bay, Toronto, Hamilton, Stratford, Oshawa, Ottawa. That's what we're seeing with record funding. And it doesn't stop there. That is just the start. People are lying in hallways for 19 hours in ER rooms. And in some ER rooms, they don't even get a chance to wait. They are closed. That is what this government is doing. They said they would end hallway medicine. They said they would do that. That's a promise. They are failing the people of Ontario. Keep your word to what you promised. End hallway medicine and put an end to the cuts that are happening across this province. Healthcare workers, stand united. We were heroes during a pandemic. We will not stop. We advocate for our patients daily, and we will continue to advocate for our hospitals. We will not stop until we get what our hospitals deserve. Thank you very much.
So people who are over there, if you guys can migrate onto the sidewalk, building property, kids come out and has asked us to move. Our intent is not to take away from anybody like their business in there, and I explained that, and so if we could just migrate to the sidewalk, that'd be great. Okay, our next speaker is our very own president, Michael Hurley.
Thank you so much for coming. I thank you so much for coming so far to make a statement to Mr. Holland, who's an associate minister in the cabinet of Doug Ford and the Conservative government. What do we know about Northern Ontario? Well, we know that people here have much less access to a personal family physician. We know that the population is older than the rest of Ontario. We know that its income levels are lower. It has a large Indigenous population, many people living without access to proper clean water or housing, meaning that their health conditions are affected by their living environment. We know that this part of the world has difficulty attracting healthcare professionals, and we know that many emergency departments in places like Thessalon and Richards Landing and other communities, their ERs close regularly because they don't have enough staff. We know that some of the northern hospitals, Kenora as an example, are unhealthily dependent on the use of nursing agencies because this government has not done anything significant to entice nurses, to train doctors, and to get them up here. We know that the hospitals in the north are overcrowded. We know that they're packed. We know that they've closed beds here. And this is what's going on also in Southern Ontario. Southern Ontario doesn't know somebody who's waiting for something like a hip replacement or a surgical intervention, the deprivation of which means that they suffer, that they can't walk, that they're unhealthy for much longer. 200,000 people waiting for these surgeries, 75,000 are waiting beyond. the medically recommended time limits into the danger zone, and this government, which said it would clear the waiting list, has not done that. Who here has not been? I've been on a stretcher waiting for care in an ER. I waited 55 hours. Who among you has not had a family member in a crisis, in a hallway, a neighbor who do you know who has suffered like that because this government has closed so many beds? And this government's funding plan is to cut the budget of the Thunder Bay Hospital and all the other hospitals by 2% after having cut it by 2% last year. And it plans to close 2,400 beds and cut 20,000 staff. And healthcare workers are here today to say, not on our watch. We will fight it everywhere.
Thanks very much, Michael. So, Kevin, I'm not sure you've been listening. Hopefully you have. Because this really isn't a workplace issue. This is really about saving lives. It's about dignity. It is about the kind of health care that we all want for our families and Ontarians want for their families. We're not going to accept care that falls for our patients. We're not going to accept these cuts. And we are not going to accept unsafe staffing. We're here united, and we are very, very strong. And we will be protesting across this province. We're going to be in Ottawa next week. May 19th, we're going to be in Etobicoke doing another protest.